Welcome back to the second portion of Joy in Our Town. Thank you for joining us once again. I am your host, Tammy Jo Johnson. Our guest for this segment is Vicky Ghiloni, public health nurse for the At-Risk Pregnancy Program, and Sue Jacks, public health nurse for the Breast Cancer and Cervical Cancer Program at the Licking County Health Department. They join us today to discuss breast and cervical cancer in Central Ohio, along with the psychological impact these cancers have on women. Thank you so much for joining us today.
Thank you.
So, now we're going to direct this to you because this is your area. Tell us what, you're a nurse, so you have many hats, but tell us what it is that you specialize in.
The program that I work at is the Breast and Cervical Cancer Project. It's a federally funded program. It's been in Ohio since 1994. Most of our monies are federal funds, but we also receive some state funding. And that funding allows us to identify women in all of Ohio, but my region is primarily Central Ohio, that are neglecting their breast cancer and cervical cancer screenings because, usually because of financial reasons. So our monies can help those women get their Pap tests done and get their mammograms done.
Wow. So, and it's breast and cervical cancer.
Yes.
Tell us what cervical cancer is.
Cervical, well, all cancer is kind of named for where the cancer originates. So when the abnormal cells originate in the cervix, then it's called cervical cancer.
Okay.
And so these two cancers, or these two screenings, kind of are a main focus that women's health is about. It's two great screenings that can be done that can dramatically save a lot of lives, because both of these exams or mammograms can find cancer at a very early stage, which we all know is very important in eradicating the cancer or surviving. So a lot of women don't have the means to go have a mammogram done or go get a Pap test done. They only go to the doctor when they're sick, not when they're well.
Right, which makes sense to me. Is that not something that...
Absolutely. We hear that all the time, especially I think women are notorious for taking care of everybody else and not themselves.
Yeah,
so when they're not feeling bad or they don't have something going on, they think they shouldn't bother going to a physician, but these screenings are very important.
Okay. I see a lot of programs that come out, and they even have like screening fairs and things like that. So what makes it not affordable?
Well, health insurance obviously was a big factor when we first got the program in 2009. There was a lot of uninsured women in Ohio at the time. With the Affordable Care Act and with the Medicaid expansion that has occurred, our numbers have decreased, which is wonderful. But there's still women out there for a variety of different reasons still don't have health care coverage. And then even if they do, the preventive screening may be paid for, but if they have an abnormal result and have to come back for additional testing, then sometimes that's not covered.
Really?
Or it applies to their deductible. So women, again, think in terms of, I can't afford that. I can't get another bill to deal with, so they don't go have those things done. So our program's a little twofold. One is that we're trying to identify those women who need our help financially, but also just to get out there and educate women as to why these screenings are so important.
That was probably the best definition of cancer that anyone's ever given me, wherever the cancer originates. That makes sense. But there are different types of breast cancer, is that correct?
Oh yes, there's a lot of different types, and every woman it's an individual journey for her, and her cancer is not like anybody else's. So when she's diagnosed, then she needs to make sure that she's hooked up with the specialist, the person that's going to be able to give her the best treatment options. But again, the breast cancer's staged or identified by the area in the breast that it was originated.
Okay. And correct me if I'm wrong, but from what I've read, everybody has some sort of a cancer cell in their body. Is that not right?
I don't know that I would say that they have a cancer cell. All of us have cells in our body who at time to time will grow abnormally or grow too much in one area, that doesn't mean they're cancerous.
Okay.
They're just abnormal. And that's a lot of times when a woman goes and has a mammogram done, they will find that, but they are quick to be able to identify that it's not a cancerous lesion or a cancerous area.
But do they wait for the next appointment to do that? Or do they do they send a letter and say, hey, you have an abnormal result, come back?
Well, with a mammogram, a woman goes initially for the screening. Radiologists look at that. If she's had previous mammograms, then they're going to compare to make sure to look for any changes. But radiologists are trained to know what looks concerning and what's not. And they'll base their recommendation on what they find. But if she does have to go back for additional testing and she's enrolled in our program, we can continue to keep paying for those additional tests for her until we get to the point where does she have breast cancer or doesn't she?
Right.
So unlike some programs that can only spend so much money per woman, we don't have a cap on that. Once you're enrolled with our program, we can keep following you so that we make sure you're going back to get those done.
Right, that makes a lot of sense. What are some of the signs of why a woman should even go to, well, I know you said that we only go to the doctor when we're sick, but even when we're sick, we still don't go get a mammogram. So what are some of the signs that would lead us to that?
Well, a mammogram is a screening that all women should, at some point in their life, do, regardless of whether or not they think there's anything wrong. Between the ages of 40 to 49, it's now being a recommendation from your doctor whether or not, unless you have risk factors, which there are risk factors involved that give you a little bit better chance that you may develop breast cancer. The statistic right now is 1 in 8 will be diagnosed in their lifetime with breast cancer.
Wow.
So between the ages of 40 and 49, that's a conversation you're going to have with your physician as to whether or not you should have a mammogram if you're not having any symptoms and you don't have any risk factors. By age 50, a woman should be getting a screening mammogram at least every 2 years.
Okay, 2 years. So tell us what cervical cancer is.
Cervical cancer is those abnormal cells that grow in the cervix. Again, they might be identified as being abnormal. That doesn't mean that they're cancerous. A cervical biopsy determines that. But if a woman has an abnormal pap, then it's important for her to go back and get those additional testings done to find out for sure that it's not cervical cancer.
Right.
Again, a pap test is another screening that all women should be doing. And there was a time in that women, it was like one of the leading causes of death in women was cervical cancer.
Really?
But with the pap test, that changed everything. Okay. Again, women need to stay on schedule and get the screenings when they're told to.
Okay. And where can they go? And you said that, did you say, was it breast cancer that after 40 they see their physician, but what about cervical cancer? Are there signs and symptoms, or is that something they should just be getting checked out with their pap smear?
There are some signs and symptoms. With cervical cancer, unfortunately, in the early stages of cervical cancers, there's often no signs.
Okay.
But if a woman is experiencing some abnormal bleeding, pain that's not normal for her, then she definitely needs to get that checked out the same way with breast cancer. A lot of times women will notice a lump or have pain in the breast, or they'll have skin changes, discharge. I always tell women that they know their body better than anybody. So if there's something that's not normal for you, then you should speak up and go get it checked out.
Wow. Can either one of those cancers develop into other cancers?
Yes, both breast cancer and cervical cancer can do what we call metastasize, which means it goes to another part of the body. So if a woman is diagnosed with breast or cervical cancer, then it's really important that she maintain being checked year after year after her treatments to make sure that nothing like that is happening.
Wow. What about, is there any other that branches off of cervical as well?
Again, it can metastasize to another area in the body. just like breast cancer can. It just depends on where does it go, that it can change at another part in the body, and then they find cancer there as well.
So what about pregnancy? Can cervical cancer, can it cause a problem with pregnancy?
Definitely, yes. And that's considered a high-risk pregnancy, and they usually end up in Columbus with a high-risk doctor.
Wow. So does that mean that the baby can get cancer? Like, what does it mean?
No, not necessarily. It's more the mother. They watch her very closely to see where the cancer is at, what stage it is at, and if they do need to do any intervention. A lot of times they'll just watch her and wait until after the baby is born and then go from there.
Okay, but if not, it can be removed.
They don't like to really do anything with the cervix because it can trigger preterm labor.
Okay. Well, even a woman that's not pregnant.
Yes.
That has, it can be removed, right?
Right, there, and that is a possibility with cervical cancer, that the woman will end up having a hysterectomy. Doesn't have to happen all the time, and again, it's based on how early did they find it.
Right. So, you know, I'm sure our audience would appreciate this just as we begin to wrap up. Are there any steps that we can take towards prevention? Is there anything that we can do so that we can lower our chances as women of ovarian or cervical cancer or breast cancer?
Well, I think first, know your family history, because that does play a very big role. Healthy lifestyle, eating the right foods, getting exercise, smoking is a contributing factor. But if you know what those risk factors are in your family, then you know to pass that on for information onto your doctor, so that they'll know what guidelines to give you as far as screenings.
That makes sense. What about the same thing goes for pregnancy, right?
Yes, absolutely.
Just making sure that, you know, we lead the healthy lifestyle, because prevention's best, because who wants to go? See, the thing is, when you tell someone the bad news, even if there's a good chance that they can overcome it, the news is news. And so it's kind of like it throws them off, right?
Exactly.
Yeah. Wow. So how can we get in touch with you? Do you have a contact information or website they can go to?
Like Vicky's program, if you go on the Licking County Health Department website, there'll be a link on there for the Breast and Cervical Cancer program.
Okay.
Also, you can actually go on the Ohio Department of Health website and get a lot of information about the program there too. If you are eligible for the program, you go through a regional office like the one we have at the health department to get enrolled, and then we take it from there as far as hooking you up with a facility that you can go to and get the exams.
Awesome. Well, thank you guys so much for being here with us today. We really appreciate all the information.
Thank you.
You're very welcome. That's our program. Thank you so much for watching. You can also check us out on Facebook at WSFJ-TV51. Join us again next week at the same time for Joy in Our Town.
This program has been sponsored by the Trinity Broadcasting Network and is made possible by your telethon dollars. Your continual support can keep Joy in Our Town coming to your home every week. Write to Joy in Our Town, 7790 North Central Drive, Lewis Center, Ohio, 43035.